Speaking unspoken truths, reframing women's health. Biases, disparities, and inequity have plagued biomedical research and resulted in worse health outcomes for women. We've known this for a long time. And given that 50% of the global population are potentially impacted, it's high time this changes. And people like our next guests are ensuring that will just happen. Dr. Daisy Robinton is our moderator. She is a molecular biologist and Ph.D. from Harvard, a writer, a lifestyle and health guru and model, but more importantly now she's co-founder of Oviva Therapeutics, investigating healthy aging in women and tackling those disparities for women. Over to you for now.
Thank you so much, Vernon. It's so exciting to be here, and I'm really excited to bring on our guest for this panel, Dr. Jennifer Garrison. Jennifer is faculty at the Buck Institute for Research on Aging and also holds appointments in the Department of Cellular and Molecular Pharmacology at UCSF, as well as the Davis School of Gerontology at UC Davis. She's founder and faculty director of the Global Consortium for Reproductive Aging, which the mandate of which is to advance knowledge in this field and accelerate the development of strategies to prevent and delay ovarian aging. So welcome, Jennifer.
Daisy? Hi, Daisy. So nice to be here. Thank you.
Yeah, so nice to be here and great to see you. We have so much to talk about, and of course we could talk about this all day long, but I really wanted to start with a very basic question, which is, when you think of the words women's health, what does that mean to you?
Right, women's health. So this is a phrase that I think has been co-opted for things like fertility and breast cancer and periods, and really has become something that doesn't have, I would say, a more holistic view of a woman's body. It really does seem to focus on diseases of reproductive organs and not women's health as a whole. Would you agree?
I would definitely agree. And I think that's something that the more that I've learned in this space, the more that I really come to appreciate about the fact that there's a holistic element that's often been left out, historically speaking, in women's health. And I think part of that really ties to the ovaries, of course, as being a key organ that distinguishes females from males. And I'd really love to chat with you a little bit about what makes the ovaries so important, but also what's so interesting about them as one of the most dynamic organs that exists on the planet.
Yeah, and this actually brings me around to something I wanted to mention right at the beginning, and that is we've called this session something to do with women's health, but we're really just talking about anybody who has ovaries, to be inclusive. But ovaries are fascinating and complex, and if you really step back and look at it, I think female reproductive physiology is one of the most multivariate signatures of human biology. And as such, we should treat it as a complex issue. Ovaries in particular are incredibly complex organs. They're incredibly complex structures. They're made up of many different cell types, many different compartments. But more importantly, they undergo a dynamic remodeling, both structurally and functionally, every single month when a woman goes through her cycle. It's dramatic. It's incredible, actually, what happens in ovaries. And this is unlike any other tissue in a woman's body. In fact, I said this to you before, ovaries reach their maximum potential before their first use. They age precociously. And this is something that I think a lot of people don't recognize.
Yeah, I think that's a really important point, that the ovaries in particular age asynchronously with the rest of the body and really are considered to be geriatric in their 30s when the rest of our tissues are at peak performance, which is something that I think when you just say those words and hear that language, it's a bit mind-blowing. We don't think of a woman in her 30s having any geriatric organ. And it's something that part of why I wanted to have this session and have you on and title this Reframing Women's Health is really to bring awareness to the fact that there's this great imbalance that's happening in the body that ties into holistic health. And I think one other thing that I always think is interesting to think about when we think and talk about the ovaries and about the hormonal shifts that happen throughout a female person's life is, most of us have some kind of class on hormones when we're about to go through puberty. We all remember that very awkward course with our peers in school when, I don't know, you're 12 years old. I forget how old we are when we have that class. And then at some point, most of us also have some kind of talk about sex, and babies and whatever. But there's not really a time in our lives as mature adults where we hear any kind of education around fertility, and for that matter, have any kind of talk about menopause as two other very important hormonal aspects of our lives that connect to our overall well-being. So I'd really love to hear a bit from you on how our ovaries and our hormonal health and our reproductive health connects to our overall health in general.
Absolutely. And I think this is an area where so many women don't understand what's going on in their bodies, and certainly there's so much information that's missing here. But menopause is defined by a woman running out of eggs. That is the definition of menopause. And if you think about, girls are born with all of the eggs they're ever going to have, their lifetime supply. I think many people don't realize this. Around 26 weeks of gestation, a female fetus has developed a reproductive system, and that has 6 or 7 million eggs in it. And those are all the eggs that she will ever have in her life. And so if you step back for a minute, what that means is that when the egg from which I came from, even though I was born in the 70s, that egg was created in 1956 in my grandmother's womb, which is a little bit sci-fi, right?
It's so cool. It's so cool.
It is so cool. Right. So a woman who's pregnant with a female baby is actually carrying around the eggs that will give rise to her future grandchildren, if she has any. It's very much like sci-fi. But I said this before, ovaries reach their maximum potential before their first use. So women, there's this graph that we're all shown and made to believe is an inevitable truth. It's that graph of the number of eggs or the reproductive potential over a lifetime, which essentially shows, a single inflection point and then a cliff. And that is a chart that every woman in America is made to believe is this undeniable truth. But that's a really inaccurate model. On average, this is absolutely true, that fertility does decline, the number of eggs do decline over a woman's life. But at the level of the individual, it's not true. Fertility and things like that are so stochastic, and they go through, these incredibly complex cycles that, we're only beginning to start to understand. It's really something that requires a lot more research.
Yes, it's true. And there's so much, while we know some of these interesting facts, maybe in the scientific community, I think one thing that really stood out to me as a trained scientist is that there are so many aspects of female health and reproductive health that I was completely ignorant to until I really dove into this field a few years ago. One of which was just that each month with every cycle, we lose something like 1,000 eggs every cycle. But, there are the stochastic elements. Sometimes that will be more, sometimes that will be less. And it's not just the one egg that we think we're ovulating every month. It's this sort of gradual decline that's bursts of eggs each month that we're losing until there are no more left, and then we have menopause.
That's right. And if you're on birth control, you're still losing 1,000 eggs per month. That doesn't. Some people think that that being on birth control means that you're not losing eggs, but that's simply not true.
Exactly. So it's not really doing anything there. And, I think one of the other things that's really struck me is how many unanswered questions there are in this field, and even very basic questions about ovarian physiology, about sort of the systemic female health and the way that hormones connect into our systemic health. So, I definitely want to touch on a little bit why we settled on this title of Reframing Women's Health, why it even needs reframing, and how is it possible that we don't already know the answers to many of these fundamental questions about women's health.
Right. How is it possible that we don't know these things? It's actually horrifying when you sit down and think about it. I think there are really two major challenges that have led to where we are today. One is funding. There's just an incredible dearth of funding in this area, and particularly around reproductive aging and longevity, but just women's health in general is woefully underfunded. When you compare the amount of money that goes into research to the issues that women are facing, it's shocking how little money there is. The second thing that I think is a real challenge is that
I was just gonna.
Yeah. Oh yeah, please come on. This is a conversation. Interrupt me.
I think I'm having a little glitch on my internet, so apologies for that. But what I was going to say was just to underscore that point. I mean, we even have some statistics on that are pretty mind blowing. You had mentioned to me earlier that the 2018 NIH budget, which is the largest public funding body for health in the United States, the budget in 2018 was $36.3 billion, and of that, only 15% or 5.5 billion was devoted to all of women's health. And so, all of women's health being from in utero to, puberty to any other kind of women's health issues to later in life, postmenopausal, all of those things. And 43 million of which is devoted to reproductive aging, which is such a drop in the bucket.
Yeah, absurdly low.
Absurdly low. And, there's huge unmet need in that space. And I think also worth pointing out is that, due to the fact that women have been perceived, females have been perceived as more complicated due to their hormones, they've been excluded from not only clinical trials, but also biomedical research just at the animal level. So research that's being done in laboratories to understand biology, but also to test drugs has been done predominantly in male animals up until 2016 when the NIH mandated that females be included. And what this has really led to is the fact that there's been a whole set of diagnostic criteria, as well as a whole pipeline of drug development that's gone for decades and decades and decades, that's really focused on male physiology, which is not servicing the unique and specific needs of female physiology. And as such, we actually have a lot of data to show that a lot of very common diseases that are observed in all people are often misdiagnosed in women, but also common medicines that are prescribed are often having greater adverse outcomes for women as well, which, when you start actually looking at these data, it's pretty shocking and infuriating, frankly.
It is. I think many people don't realize that there's just been this over-reliance on male models systems in research. And that's really blinded us to specific vulnerabilities that affect females. And a lot of people, when I tell them this, they're like, what in the world? Why would that be the case? That doesn't make any sense. Like when you're doing animal studies or studies in, anything, even in humans, why wouldn't you include both males and females, right? But it turns out that ovulatory cycles are complicated, and biomedical research at large has considered them to be a confounding variable, meaning that they introduce noise into the system, and it takes more time to take into account all of the phases of a female cycle in doing research. And so it's much easier to rely on males for studies. But like you said, that's a real problem.
Yeah, it's a real problem. And I think, even sort of returning to this idea of reframing women's health, we characterize that as a subcategory of health, despite the fact that it's 50% of our population. And really, we haven't dedicated a commensurate amount of resources to this, but it's also just a feature that is persistent in scientific culture. I mean, I don't know about your experience, but as recently as last year, I was working with a company developing a new therapeutic for COVID really early in the pandemic. And I was directing the preclinical program to put together the experiments we needed to test this in the different animal models that we were using for testing medicines against SARS-CoV-2. Hamsters are a really great model for that. And so we were on a call with a bunch of people talking about this experimental design. And one of the scientific founders of the company suggested we drop the female hamsters to reduce the complexity. And, I understand the rationale. Of course, we're always sensitive to time and resources and efficiency and clarity. And I think, this stretches, of course, beyond just the male-female dynamics, but also the broader diversity in our population. So much of our diagnostic criteria and so many of our therapeutics have been developed for this very narrow sliver of people. And it's not good enough, and we need to do better. And that's going to cost more, and it's going to take more energy and attention. And I think that's what's appropriate to really drive innovation. Not to mention the fact, aside from the fact that it's important in general for everybody, there's a huge market willing to buy. There's a lot of women in the world that would really love to have their needs met and would really love to have therapeutic options for menopause, for things outside of fertility, for endometriosis. for all of these kinds of things. So I think that's, we can't say that enough. I can't emphasize that enough. It's partly why I got into this field. It's partly why I founded Oviva Therapeutics, to really address this unmet need and drive awareness into this space, for one, but also just resources, funding, looking at the questions we need to answer, and then trying to answer them.
Absolutely. We have clearly a shared vision here, as we've hit on many times. I mean, imagine what would we know about human biology if, the same amount of attention and resources that have been devoted to studying male systems had been given to study female physiology as well.
I think
talk about for hours.
We could talk about it forever. And I think, just to bring back what you had talked about around the ovaries in particular being such an interesting organ. I mean, when we get massive innovations in healthcare or in science, in anything really, often it's borrowing principles from one system and putting them into another. And I think when we think of the ovary as a system has complex remodeling every month, I'd love to hear you just break that down a little bit more for everybody. But being able to think about that when we think about how we are driving forward bioengineering, cellular remodeling, stem cell therapeutics, regeneration in our body, how we think about aging overall, and the lessons that we might learn if we only cared to ask and fund the research that would answer some of these questions.
Yeah, I mean, as you well know, I'm passionate about trying to understand what is it that causes menopause? What is the biological cue or timer that so reproducibly, in a woman's third decade, without fail, every single one of us on the planet who has ovaries is going to face this, that causes ovaries to start aging prematurely. Anyway, but the idea is, the idea is bigger than just fertility. Certainly, the things that we're working on are going to benefit female fertility, but this is so much bigger than just female fertility, because menopause, even in healthy females, it leads to an incredibly, it has an extreme negative impact on women's health overall. So when a woman goes through menopause, it is pretty much the worst thing that can happen to her body if she's healthy. It increases risk for cognitive decline, for heart disease, for osteoporosis, for bone loss, for stroke. I should just keep going on and on. And the fact that women have this reproductive decline that happens in midlife, whether or not I wanted to have children, from the moment I went through puberty, the fact that I was going to go through this reproductive decline in midlife, it impacted every decision that I made as an adult. It impacted my choices around my career. It impacted my choices around my health, around my family planning. It impacts everything. And so this becomes an issue of equality, because men do not have this thing hanging over them that they have to take into consideration throughout their adult lives. The other thing I would say is that, we've done an incredible job. I'm a faculty member at the Buck Institute, which is wholly devoted to understanding aging. And the reason that we care about aging so much is because aging is the major risk factor for every disease of the modern world. If we can understand what's causing aging and intervene, we can have an effect not just on one, horrible disease that everyone is afflicted by, but all of them. And so, when we think about menopause, since we've been able to add so many years to human lifespan, now, women who are born today are going to live more of their lives after menopause than before. And if you consider that menopause is essentially, a huge, huge, huge negative thing in terms of women's health, that's amazingly detrimental. There's a huge, we have the statistics for this as well. The economic impact of menopause is astounding. I mean, it's really just, it's hard to wrap your mind around. There's a profound impact. If you think about how many women are going through menopause right now, it's something like by 2025, 1 billion women worldwide will be actively experiencing menopause. That'll be more than 10% of the global population. And, in terms of economic costs, there are costs related to healthcare. There's costs related to lost work. And these run into the hundreds of billions of dollars. So, even if you don't have a mother, sister, friend, partner, daughter that you care about in your life, the fact that menopause is such a huge impact on the world's economy should be something that makes people sit up and listen. I don't understand why it is that this is not like front page news like every single day. Yeah.
I'm totally with you. The numbers are staggering, and the health consequences are staggering, and the market potential there is also staggering. I mean, there's a huge market. There's not a lot of viable options available for people who suffer from symptoms relating to menopause. I think it's something like 70%, 100% of women enter menopause if they live long enough to enter that phase of their life, which generally I think is on average 52 is the current average age of menopause. And as you said, the life expectancy has been increasing for our population over time. And so we're entering this phase where a greater proportion of our lives are going to be spent in those years after menopause, when we have this huge hormonal shift that not only have we not prepared anyone for in terms of any kind of public awareness, public health, education point of view, but there's also an utter lack of resources for women, and a lack of options. Of course, there's hormone replacement therapy that's been unfortunately really smeared with a sort of public health messaging snafu. It is a very viable option for many women, but there are women that it doesn't work for, and it's really unsettling that it's one of the few things out there to really address the huge score of symptoms that occur for women who are in menopause and symptomatic. And one other little tidbit that I always think is interesting is there's actually been some work out of C. Horvath's lab at UCLA, who was looking at how the hormonal changes in menopause impact cellular aging in the rest of the body. And what he found was that once you enter menopause, all of the shifts that occur in your body actually accelerate somatic aging, so aging of the rest of the body, by 6%. And so you get this sort of accelerated aging that occurs once you enter this phase of your life. And really, we haven't provided any tools for people to forestall that or manage that or, make that better in any capacity, which I think is hugely important. But you also bring up something that I did want to touch on briefly, which is this idea of separating fertility from women's health, because of course, many women care deeply about their fertility, want to have families, want to have children, and there's plenty of people who don't, and there's plenty of people who identify as a female person outside of being a mother, and we need to care about health outside of fertility itself, and really paying attention to that broader scope of what that means. What does well-being mean at all stages of my life, whether or not I choose to be a parent? So I think that that's something that I really would like to underscore. And I think that the work that I'm doing at Oviva, certainly the work you're doing with the GCRLE and at the Buck, is really addressing. And, I'd actually love to take just a couple minutes, if you could just tell us a little bit more about the GCRLE and sort of the broader scope of what's being done there, and maybe a little bit of the research that's happening there that's going on, because it's such an amazing institution. I mean, I actually first met you because I read the white paper. It's called The Unspoken Truth on the GCRLE, and I was like, this is amazing. Everyone needs to know about this. So I'd love for you to just share a little bit about that here.
Thank you. Yeah, I really enjoyed writing that, actually. So let's see. We keep saying GCRLE, but I should step back and say the Buck Institute really launched a moonshot a few years ago to tackle female reproductive aging. And that was with the support and the vision of the Biomedical Foundation, who are really the seed investors in this field. Mm-hmm. And when I say field, what we're doing is building the ecosystem around the science in this area. So there really, before we started doing this, there really weren't a lot of scientists working on female reproductive aging. And then that is because there has been a lack of funding. So the Buck Institute started a center to basically study female reproductive aging. And once we did that, so we have scientists working at the Buck Institute on these problems, we realized that basic research in this area is just woefully underserved. And so we started a global consortium. So it's the Global Consortium for Reproductive Longevity and Equality, which I know is a mouthful. But as we're making progress at the Buck Institute and in other places, extending healthy lifespan, if we don't address reproductive longevity in females, then gender inequality is actually going to get worse, not better. And so, you know, it truly is, the equality in that name is we think really important. And, you know, it extends beyond just thinking about women going through menopause. You know, females, you know, overall reproductive health is linked to overall health in women, even in young women, right? So, for example, young women who have PCOS or polycystic ovarian syndrome are more likely to have metabolic dysfunction, and those sorts of relationships extend through a lot of different physiology in women. So this is an area of research that is important for young women, for older women, for men, for everyone, and it has been just woefully underfunded. So the consortium, you know, our goal truly is to accelerate and facilitate the research in this area. And what that means practically is bringing scientific discoveries that people are making at the bench and accelerating it, getting into the hands of women faster. And so I mean therapeutics, I mean diagnostics, I mean products. And so what we're trying to do is to facilitate conversations between people who would not normally talk to each other. Right? So scientists talking to clinicians, talking to people in pharma, talking to potential funders, talking to you who are listening in the audience. And by the way, if you have any questions, please put them into the chat, because we would love to actually make this, you know, interactive and hear from everyone who's listening about what they're most interested in talking about. But, you know, facilitating the conversations, building a network, and essentially bringing everyone together so that we can make things move faster. And the goal, the end goal, the moonshot goal is to understand what the fundamental drivers of ovarian aging are. Because, you know, at this point, if we don't understand what that cue or that timer is, that biological cue that tells a woman's body to start going through this reproductive decline in midlife, and it, you know, it could happen at any point. It could be something that happens during development. It could be something that happens during puberty. It could be something that happens in perimenopause. We don't know. But until we have that information, everything that we're doing is just a Band-Aid. You know, we need to understand what's actually happening if we're going to do any kind of intervention. And that, you know, the goal would be to increase the number of eggs that a woman has, both the quality and the quantity, later in life, so that we can push forward the age at which a woman goes through menopause. And ideally, get rid of it, because quite frankly, it's not necessary. We are so bizarre as a species, right? I mean, humans are one of the very few species that undergo menopause. It is not necessary.
Right, it's humans and a few species of whales, right? They're the only creatures that have menopause. That's it. Possibly
one species, the monkey, but this is a little controversial.
Yeah, I mean, that's even that, like, why don't we know this kind of thing? It's unique. It's almost unique to humans. And in terms of how well conserved so many other things are, I think it's really remarkable, and something that, you know, just for curiosity's sake, if not for the well-being of so many people, it's something that's fascinating to understand in greater detail. And like you said, I think there's this continuum that we don't really appreciate, because there's been this lack of inquiry, really, in terms of how, you know, essentially from the time you're at 26 weeks gestation, in utero, in your mother's womb, you're already experiencing ovarian aging at that time. And by the time you're born, you've already lost the vast majority of your eggs, actually.
That's right. 7 million you start with, 1 million by the time you're born. Why is that?
It's crazy.
How is it that we don't know why that is?
And what would happen if we could be born with all 6 or 7 million? You know, I mean, maybe a bunch of them are just terrible, poor quality. We don't know. But that's what I think is so fascinating, is there's so many really exciting, interesting questions that we can answer now if we dedicate resources to it, which, you know, I'm so excited that you're really driving this forward at the Buck and with the GCRLE. And, you know, I'm really excited to be having this conversation with you on this stage. And like Jennifer said, you know, if there's anyone who has questions about any of this, we have a couple questions coming in that I'll get to in a moment, but we'd love to hear anything else that anyone has to say or has to ask. We'd really love for this to be a dialogue, because there's so much to talk about, and really so much that's not known. So maybe I'll actually dive into these questions, if that's all right with you, Jennifer, and just get started with some of what we have popping up here. So I have one question from Molly Andrews, who's asking, she says, many women who have gynecologic cancer have delayed diagnosis and it is too late to cure. I want to know if there are any measurements or innovations to help them get early diagnosis and be cured. That's a great question. And also, like, maybe I'll just separate that into two pieces and then throw it to you, Jennifer, which is the diagnostic element and then the curing element, which are can be two very different things, although they can relate to one another. What are your thoughts on that?
I am not a physician. I'm a Ph.D. scientist, and cancer is not my area of expertise. However, I will say that part of the lack of information, essentially, around women's reproductive organs, there's just generally speaking a lack of knowledge in this area, and part of that extends to things like gynecologic cancer, and having a diagnostic for something like early gynecological cancer relies on us having a set of markers for each reproductive tissue. So ovaries, there's uterus, lots of other tissues make up a woman's reproductive tract. But having reliable markers that distinguish those tissues, having reliable markers that distinguish those tissues throughout a woman's lifespan, right? So something that could mark a young uterus from an older uterus, but then also having markers that would distinguish between a healthy uterus and a potentially cancerous uterus. Those are all active areas of research. And so I think it's, this is something that hopefully will come out of the work that we're doing to try to refocus attention and funding on women's health, but we're not there yet.
This might not be an appropriate question for you, given that you just clarified you're a scientist, not a doctor, but I do think it's something interesting that I certainly think about a lot, which is a little bit of a sort of screening element of how female people engage with the health system to sort of check in on how we're doing and the regular types of things that we do. We all get pap smears, I forget what it is now, every 2 or 3 years, things like that. And I don't know, one thing that has really stood out to me in my own experience was that within all of the interfaces with the medical system that I have regularly as part of my checkups, there aren't often, check-ins about fertility, for example, and not a lot of conversations around that. And, of course, in the US, I know it's different from other places in the world in terms of how healthcare is provided, but I'm wondering if you have any thoughts around how women can better access information about their health if they are curious, whether that's fertility or cancer screening or otherwise. Would just love to hear anything that you might have to say about that.
This is something that is so important, and one of the parts of the network that we're trying to build out, which is to give both female patients, but also their physicians, more resources, like immediately accessible resources to both learn about their health, but also just to, even at the very superficial level, to give women a list of questions that they should be asking their doctor. If you're 30, here's a 1-page list of questions that you need to ask your doctor, so that you have a picture of your health, a snapshot of your health in time right now. And conversely, on the side of physicians, to give them, palatable and easy to digest information about what the most recent and up-to-date research is, right? Because there is new research coming out every single day, and it's not always possible for a practicing physician to keep up on the literature. So we have projects in this area to try to coalesce that information and get it into the hands of women. But there are so many companies now, actually, startups in femtech, really, that are both focused on young women and fertility, but also on older women and perimenopause and menopause, that are, run by women like you, Daisy, who are, passionate Ph.D. scientists who think a lot about data, and those companies are collecting data and they're publishing it. I mean, there's a study that just came out from EverNow, which is a company that is focused around helping women choose hormone replacement therapy in menopause. And they just published, they're collecting all this data as they're helping women patients, and publishing the data that they find. And this is really imperative, because there just aren't large data sets that collect really detailed information about women as they track through their adult lives. There are many companies like this. And so, as we get more and more information and more data, we'll be able to predict, more readily what sorts of, at an individual level, where the hallmarks are and where the
Yeah, I think that's such a great point. And it also brings to mind, my sister has 2 kids, and I recall during her pregnancy, all these weird things were happening. And then right after birth as well, there were lots of, she had a challenging time for a number of reasons. And I remember talking with her about some of what was going on and just being like, why don't people know some of these very important things about her health and also the health of the fetus inside? Like it's remarkable. Like you're saying, Evernow, I'm so glad they exist. They're doing some really excellent work. Electra Health is another great one in the menopause space, but having more data collection happening, both for menopause, but also for pregnancy, also for fertility for that matter. But of course, there's a whole fertility industry that's doing a lot, and there's a decent amount of data sets there. But I think
I need to say this because you brought up fertility. Is that we don't talk much about IVF because I think about it sort of like a Band-Aid, but it's also it's kind of barbaric what we do to women to help them get pregnant. And IVF has been around for 40 plus years. It was developed not as a tool to help infertile women, but rather as a tool to help women who are going through cancer treatment get pregnant. And there's been an enormous amount of research capital, of advertising capital, of governmental capital to subsidize IVF, a huge amount of money poured into IVF over those 40 years. And much of the research has gone into making IVF better. Which is, it's a fundamental problem because IVF is a Band-Aid. And again, if we don't understand what the drivers of ovarian aging are, we're never going to be able to solve this problem. And I've heard this mentioned several times. Imagine if we took just like a fraction of that money that had been put into IVF research, advertising, government subsidies, and had devoted that to trying to understand women's health, where we would be right now.
It's remarkable. Thank you for bringing that up. I think it's a critical space. And again, I think kind of goes back to what we've touched on a few times of there being kind of multiple, really women's health is kind of a subcategory now, but we really should be having all these other things as subcategories, and fertility has been dominant, but there's so many other areas that deserve attention. And like much of our healthcare system, a lot of the therapeutics that have been developed, they are Band-Aids to problems rather than understanding the underlying fundamental principles that are driving disease, which, I think we've been reactive as a society to things that occur rather than thinking proactively, preventatively. Certainly we could all exercise more, eat better, blah, 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 and have better health, and everyone just wants a pill, right? So this brings me to one other question we have. I'm not sure what you might know about this, but if you do, I'd love to hear it. What is a healthy diet for women's health? And maybe I'll add on to that. How might that change throughout her cycle or throughout stages of her life? I don't know if that's something you have any expertise on, or if you're aware of any great research that's related to or funded by GCRLE, but I think that's an interesting question there.
We actually did fund, so GCRLE, I didn't mention this before, we've given out $7.4 million in grants this year to fund scientists working in the female reproductive aging space. And what's really exciting about that is that we've got 22 scientists all over the world who are tackling this problem now. And we want to continue to support research in this area. And we do have some grantees whose projects revolve around trying to understand the interplay between the environment and, ovarian either quality or number of eggs in aging. And so I would say the jury is out. There's certainly a lot of data out there around overall female health and diet. And again, I'm not a physician, so I'm not going to comment on anything specifically, but Carlos Ribeiro and Zita Santos, who are at Champalimaud in Portugal, are doing this really cool research on trying to understand how sugar and other sources of dietary nutrients influence ovarian aging.
Very cool.
Very cool stuff going on there.
Well, we only have probably less than a minute left, so I want to just first thank everybody who came to attend this session. Thank you for coming to learn about this. Thank you so much to Jennifer to come and speak about this with me on this panel, and thanks to CogX for having both of us and really spotlighting something that requires so much more attention and funding, and we're really grateful to be here for that. And maybe I'll just let Jennifer share a couple places you can find her, Twitter maybe, or LinkedIn, or online.
Oh yeah, thank you, Daisy. Thank you, CogX. Thank you, Vernon. This was really lovely. Yeah, you can find us at the buckinstitute.org/GCRLE. I'm Jen Garrison on Twitter. And, I just want to leave everyone with the idea that, this is reproductive longevity is really about equality and health.
Thank you so much, Daisy and Jennifer, for shining a light on what are massive gaps in the basic understanding of biology of women's health, and the need to unlock the funding and incentives for innovation. Thank you very much.